Hello, my name is Dr. Ching Boon. I'm a Hong Kong registered chiropractor. Today, I would like to talk to you about a very important muscle group in our shoulder joint known as the rotator cuff. Before we delve into the details, let's first talk about the anatomy of the rotator cuff. So first of all, what I have here is a model of the right shoulder joint. Over here, this part which is facing the camera is the front, and this is the back, and it roughly fits around our shoulder like this. Okay, and the first thing to note about the shoulder joint is that it's made up of our humerus, known as the arm bone, clavicle, known as the collarbone, and the scapula, also known as the wing blade. Now what happens is that the head of the humerus it fits into this glenoid cavity that's formed by the scapula to form a ball and socket joint over here. The rotator cuff is a complex group of muscles and tendons whose primary function is actually to perform internal and external rotation of our shoulder. They also have a very important function, which is to keep our humerus head within this glenoid cavity by forming a covering over the humerus head like this. The rotator cuff muscles, they actually originate from the scapula itself, like this, and then all of them would attach to the head of the humerus. And this is how they stabilize and provide strength to the shoulder joint as we use it in our activities of daily living. Now, let's talk about the rotator cuff muscles. They are made up of 4 muscles known as the sits muscles. So the first one is the supraspinatus muscle, infraspinatus, teres minor over here, and the subscapularis muscles in front here. So as mentioned before, these muscles are the ones who are responsible for providing strength and stability to the shoulder joint. And right now, another thing to take notice of is actually between the rotator cuff and the acromion process of the scapula, there's a gap over here, and this gap houses a fluid sac and lubricating structure known as the bursa. So what does the bursa do? The bursa actually helps to protect and cover our muscles and tendons and keep them from coming in contact from the surrounding bone. This would allow our tendons and muscles to move and glide freely as we make our movements. So if let's say we got a tear or an injury to our rotator cuff muscles, any one of them, because they all attach to the head of the humerus, it could irritate the bursa, causing it to become inflamed and painful. So I hope that now you have a better understanding of the anatomy of the shoulder joint. So with that in mind, because of how this joint is stabilized by a muscle group only, okay, and of course there are some ligaments which helps to stabilize the shoulder joint as well. Its stability mainly comes from the rotator cuff muscle group. So it gives us plenty of mobility at the cost of being more prone to injury. So as you can see, the tendons here, the bursa, our muscles, they're all subject to injury if we overuse them, underuse them, or if any direct trauma gets to them. And this is why the rotator cuff muscle group is very important for us to look after and care for. So let's talk about rotator cuff strain first. This form of injury is the most common cause of shoulder pain and disability among adults, especially those whose age are above 40, but it can affect those who are younger as well. It tends to also affect males more than females. A rotator cuff strain is the overstretching or a partial tear or complete tear of our rotator cuff muscle belly or its tendon. The severity of muscle strain is dependent on a few factors. First of all is how much fibers were damaged, severity of the pain, and also the strength of muscle contraction. So for rotator cuff strains, they are mainly divided into two types. The first one is the acute traumatic type, and the other one is the degenerative type. So first of all, acute traumatic strains usually occur when there's a specific trauma to the shoulder joint or the rotator cuff. So one such example would be falling on an outstretched hand like this. So besides risking the injury in the wrist, you can also injure your shoulder as well. A violent blow or direct blow right to the shoulder can also cause rotator cuff strain, no matter in which direction. Acute traumatic strains also tend to occur if we use our shoulder joints excessively over a short period of time. So this tends to happen in athletes who are training and they perform repetitive overhead motions or forceful pulling motions. Both of these would actually increase the risk of someone younger getting a rotator cuff strain. So examples of sports which tend to overuse the shoulder would be playing tennis, playing badminton, playing baseball, or even volleyball. Acute traumatic strains can also occur in the workplace, especially if you are more of a blue-collar worker or if your job involves a lot of heavy lifting. So overexerting yourself while you're lifting, or overexerting yourself if you are putting let's say you are putting something heavy up a top shelf like this, can also increase the risk of getting an acute traumatic rotator cuff strain. So examples of jobs like this would definitely include flight attendants, the supermarket staff who restock the shelves, and also delivery people, because you never know what sort of package you're going to have to deliver. It could be very heavy. Now let's talk about degenerative strains of the rotator cuff. Degenerative strains of the rotator cuff are usually those which occur as we age slowly over time, and they are usually painless. So that means you would not be likely to be able to detect that you have a degenerative type strain. Degenerative strains are usually a result of wear and tear that occurs slowly over time. But this does not mean to say that as we age, we will definitely be getting a rotator cuff strain. This is more for those who overuse their shoulder joint, but in this case, it's over a longer period of time. So the wear and tear becomes more apparent as we grow older, as it piles up on top of the pre-existing wear and tear that we get as we get older. This is usually painless, and this would also be more common in our dominant hand, such as for me, if I were to get degenerative rotator cuff strain, it would be more likely in my right side. And if I do have a degenerative rotator cuff strain on my right, the likelihood of me getting a rotator cuff strain on my left is also increased actually, even if I do not feel any pain on either sides. However, even if it's painless, there would be other symptoms that you would notice. Most likely would be a decreased range of motion, or perhaps some clicking sounds in the joint, but more into that later. Degenerative rotator cuff strains are usually also associated with minimal trauma, secondary to long-standing cases of tendinitis. If you had sustained an injury to the shoulder joint some time ago and did not get care for it, it could then develop into a degenerative rotator cuff strain. So people who have pre-existing shoulder injuries or shoulder impingement syndrome are also more likely to develop rotator cuff strains. So now let's talk about the possible symptoms of a rotator cuff strain. First of all, you would feel pain at the top and side of the shoulder. At the point of injury, there could be a popping or tearing sound, followed by pain and weakness of the shoulder. And when you move your shoulders, there could be clicking or snapping sounds, known as crepitus. The pain is also worsened when you lean on your elbow and shrug your shoulders upwards. You find yourself unable to tolerate overhead motions. There's also a loss of strength in the shoulder. And in more severe cases, redness and swelling in the affected shoulder can also be symptoms of a rotator cuff strain. The pain is present even at night, especially when you lie on your side with weight bearing on the affected shoulder. There is also a gradual loss of range of motion on the affected shoulder. If you suspect you have an injury that has been persisting for a while but did not get any treatment. At the chiropractor's office, a detailed medical history will be taken to gain a better understanding of your general health, as well as if you have any other medical conditions that we should know of. And then after that, we would perform a comprehensive physical examination to help rule in or rule out certain conditions that we think could be related to your condition. And a few of these will include assessing the movement of your shoulders in certain movements, either by yourself or passively, which is without the activation of your own muscles. Muscle strength testing can also be performed by getting you to put your arm in a certain position, and then we test the muscles by getting you to resist our force like this. After the examination, we will try to determine whether it is one or more rotator cuff muscles which are affected, and then come up with the best treatment plan for you. There could be a need to refer you for further imaging, so this can be done either via X-ray imaging or the golden standard, which is MRI. So let's talk about management and treatment of rotator cuff strain. First of all, for an overstretched or partially torn rotator cuff muscle, we can use conservative care, which is highly effective in improving pain, function, and reducing disability of the shoulder. Modalities such as therapeutic ultrasound, shockwave therapy, as well as interferential current therapy all help in reducing pain and swelling around the joint. And of course, prescription of rehabilitation exercises would be very helpful in making a full recovery for rotator cuff strains. As chiropractors, we also use joint manipulative therapy to help reduce the tension around the shoulder joint by adjusting the joints of the neck, upper back, and the shoulder joint if needed. And in more severe cases, it may even take up to 1 year to make a full recovery. For patients who suffer from a completely torn rotator cuff muscle, surgical intervention is required. And that's the end of our talk today. I hope you found the information useful. And if you do find it useful, please do like, comment, and subscribe to our channel to learn more about chiropractic and physiotherapy. If you have any questions, please do leave a comment below. And I'll see you again next time. Bye bye!